Welcome to The Buzz, where we bring you leaders in dental education, discussing hot topic courses and industry trends. I'm your host, Vanessa Emerson, founder of Dental Speakers Bureau, and today I'm interviewing Anne-Marie DePalma. So glad you're here, Anne-Marie.
Thank you, Vanessa. I'm glad to be a part of the program.
Anne-Marie is a columnist and feature writer for dental publications, as well as a textbook chapter author. She is also a dental software trainer. Anne-Marie provides continuing education programs on a variety of topics, and today we're going to be talking about her clinical presentations. So Anne-Marie, could you get us started by helping us understand what would be happening in the dental practice that typically would cause your attendees to be attracted to your clinical presentations?
Thank you, Vanessa. As a dental hygienist that I've been in practice for years, I no longer clinically practice, but I have practiced in both general and perio practices. I found that many practices, there was a lack of understanding and communication between all of the team members. Team members would not be on the same page oftentimes regarding a specific clinical or non-clinical topic.
I see. And so tell us a little bit more about your courses. I imagine that will help us understand for each of those how that relates.
So, for example, my dental implant programs. Yes, as hygienists, we know about the maintenance. We have many programs that are available on dental implant maintenance. But what about the hygienist that's new, or even the seasoned hygienist? What do they know about the basics of implants? And I have one program called the Basics and Beyond that goes beyond the basics. It takes everyone on the same page, and yet we go from the initial parts and pieces all the way through to the maintenance for the patient, which is so important, to what we do as hygienists and dental professionals in the clinical setting for maintaining implants.
That does sound really meaty, lots of content there. Do you have other clinical courses?
Yes, I have a course on developmental delays for children. Now, I never worked in a pediatric practice, but I saw patients who were parents, grandparents, or even some younger children when they came in with their aunts or uncles for their dental appointment. And a child, as they're going through the early stages of development, needs to have certain milestones. And oftentimes, as dental professionals, we can be open to noticing those that oftentimes parents and even medical providers may kind of poo-poo. So I talk about those in a referral area. How do you, if you notice something in a young child, whether it's your own or someone else's that you're associated with, how do you refer them to the appropriate channels? And what should you as dental professionals do for them? Because we know early intervention in a number of areas is so important.
Well, that is important and a unique topic. I believe you shared with me before that you were a TMD patient.
Yes.
And do you have information you share on that topic?
I have unfortunately gone through a number of TMD treatments ranging from appliances to surgical intervention, where when I was undergoing my treatments as a dental professional, I was having some difficulty understanding and obtaining information. So if I was having difficulty, imagine what the normal lay person would do. So I started speaking and writing about it and developed a basic TMD program that also involves some of my experiences and how that can translate to what other patients are experiencing and provide the dental professional with a little bit of background into what actually happens with a TMD patient.
Oh, that's really interesting. I'd love to hear that one, actually. Now, other hygiene-related courses, we talked about how it relates with dental implants, but do you have other topics there?
I have a program called Taking Dental Hygiene to the Next Level, which talks a little bit about things like camera and radiographic protocols. So, for example, many practices take radiographs at every 6 months or once a year, but does that really follow the ADA guidelines? And a lot of times practices aren't following those. They often will look at production, and I get the whole production side of it, but yet what are we doing to enhance our patients' health? Not just necessarily the practices, but by doing the right thing for the patient, you also influence your productivity as well.
Oh, absolutely. And I believe there was one more, if I recall, documentation. I believe was the last topic.
Yes, the documentation. That's a little different. I talk about documentation from both the business side, what the business team should be doing, as well as from the clinical side, what the clinical team, as you're seeing the patient and we're moving towards a more medical model of dentistry, no longer does the two carps epi, scale, pro, and bite wings satisfy. We have to be putting in our diagnosis and our treatment plan and following a little bit more of a medical model. And the same on the business side. So we look at all of that, and then I take the same basic steps that we do to document our patients, I take that and move it towards how do we document ourselves. If you're looking towards a new position in whatever area, whether that be clinical, business, or beyond the operatory, you want to be able to present yourself in a professional manner. Remember, you only have one chance to make a good impression. So that's what we do with that program. We take what we do through our documentation and move that into documenting yourself.
I love that bonus aspect of that course. That's fun.
It is a lot of fun.
So tell us a little bit about who are your typical attendees. Is it only, the back office or doctor and hygienist, or is it the entire team? And then a little more about the format, typically the length, and is it more lecture or workshop, or, what would we expect?
All of my courses, whether they be clinical or some of my other topics, lend themselves to team participation. It's not just the hygienist or the assistant. It also involves the business team, and sometimes the doctors as well. But most often it's for the dental teams themselves. My programs are usually 3 to 4 hours, but yet they can be combined. We could do a documentation one with a TMD one or an implant one. Whatever works best for the particular group is what I'm open to. So we work, my programs are working towards what the group wants versus having a set protocol that I say, okay, this is what we absolutely need.
Oh, that's great. And then what about, is it lecture format typically versus like a workshop, or is it as far as
most of my programs are lecture, but we have participation. I do little activities. And there's one non-clinical program that is actually participant-based, and we can talk about that in one of our other videos. But it's a great way to engage yourself, learn a lot, and have some fun while you're doing it.
Oh, definitely. And one of the things I really appreciate about the presentations that you bring to the market is that you have a wide variety to choose from for the meeting planner who may want to put together a full day, or even just be able to kind of mix and match, pick and choose for what's the best need for their group. So
exactly.
So that's right. To be able to have multiple options, which is really a great thing. So was there any additional information that we might want to share with the meeting planner before we go?
I think we've pretty well covered most of what my topics are all about on the clinical side, and we'll discuss more in our other videos.
Well, sounds good. Well, thanks for being here, Anne-Marie, and sharing with us about your clinical presentations.
Thank you. Have a great day, everyone. Bye.
And to learn more about Anne-Marie's presentations, visit dentalspeakersbureau.com, where you'll find her listing. You'll find her contact information there. If you'd like to email us, info@dentalspeakersbureau.com, we'd be happy to put you together. So thanks again, and until next time, be well.
Bye.